have a very demanding public. Yesterday, certain issues were raised in the panel discussion. Somebody spoke about the security of the doctor. Who gives security to the doctor? Then there was the question of patients looking up cases on the internet and questioning their doctor. The consent form came in. Each time we opened any discussion, we reverted back to the customer and we spoke about customer satisfaction. Today it is a reality that we have a very aware public, and more so after the coming of the RTI, after the coming of the Right to Information Act, we require transparency and sincerity within our working. Besides this, it is very difficult to measure the quality of healthcare. It is very difficult to quantify healthcare. And usually it is seen that whenever a patient comes to the hospital,
okay, I think we'll serve the tea.
he leaves with a feeling of gratefulness to the doctor.
So the tea will be getting cold.
Yes.
Yes, more.
No, sir. Yes.
He leaves with a feeling of gratefulness to the doctor, but not to the institution. So somewhere that belonging to the institution has to be instilled in both the doctor as well as the patient. We have just said that public relations is very important from an economic point of view. It is very important because we are part of the public, our customers are the public. We have hospitals which are run on a trust basis, we have hospitals which are owned by the government. It is very important to maintain good relations with all these organizations because they are going to fund us, they are going to lay down our laws. The hospital has a mandatory requirement to provide certain information to the government regarding certain communicable, non-communicable diseases. In every work that it does, the hospital has to deal with the public. And I believe there is someone from the blood bank here, Madan. There must have been many instances when you've required blood from the public, right? There must have been many instances where you've asked the NGOs to help you out. So each time you require these things, you can't go to a stranger and ask him for these things. It's very important to maintain some kind of contact with all these organizations so that in times of need they are there to help you. And then how many of us, let us be honest with ourselves, sometimes there are cases where the hospital really messes up. The hospital does manage not to do things in the right way. And the media does a lot of mud raking. Who will control the media in those times? Who will say, please go soft on us? We can do it only if we maintain good relations with them. It is not just the patient, it is in all aspects of the functioning of a hospital that the doctor and the administration have to think about maintaining good relations. Which is why we are here today to discuss public relations. And it is a hard factor today that demand far outweighs our provisions. So we are always short of time, and we use that as the prime excuse for saying that, oh, I'm not to be bothered with these things. I have a long OPD list of 80 people. Please don't tell me to be polite, be nice. I'm not bothered for these. I have to see all these 80 people and go home. Right, it happens with all of us. Now, there was a classic definition for public relations which is given by experts through the centuries. It says, public relations is creating an understanding for or goodwill. This definition is taken from the industry towards a company, person or product. But Burney says, he's just summed up the whole thing very succinctly. He says, the three main elements of public relations are informing people, persuading people, and integrating people with people. To put it very simply, it means inculcating a mutual understanding between the external as well as the customer? Who is the internal customer in the hospital? Employees. You and I are the internal customers. So, good public relations simply means good communication, good rapport between the administration, between the doctors, and between the public. Another definition says it's the sum total of all activities undertaken and directed towards projecting the favorable image of the institution, which in turn have an effect on making the opinion of the community towards the hospital. It's very good that I'm going over definitions while you're having tea. It is basically an effort to understand the public and of the public to understand the organization. Now, what is this public relations basically made up of? It's made up of three things. The impression or the perception of the public about us, our behavior towards the public, and what is our behavior, what lies behind our behavior? It is our attitude which lies behind our behavior. So our attitudes, our behavior, and the impression the public receives from those attitudes and behaviors. That is what composes the entire gamut of triangle of public relations. Basically, we have, in a hospital, we have the doctors and the nurses, we have the management service, and we have the patients and the community. It is a balance of information and a balance of good relationships between these three components that composes good public relations in the hospital. And what leads to, what hampers public relations? Patient dissatisfaction and staff dissatisfaction. Let us remember, our customers will be dissatisfied with us if we are dissatisfied with our organization. So for any hospital management to inculcate customer satisfaction, it is very important first to gain employee satisfaction. And why is the staff usually dissatisfied? There are four main reasons. There may be a dearth of material, resources at their disposal. There may be some discrimination between two individuals at the same level. Or there may be different levels of performance in the organization, which lead to some dissatisfaction among employees. Or sometimes the person may not like the work he's assigned. He may be qualified for something else, and you make him do something else, he might not just like it. What happens due to material and resource constraints? There is a term used in industry again, which has now come to medical care. Ergonomics. Bad ergonomics. You know, my office is not good. The space is cramped. I don't find my chair comfortable. I'm supposed to do administrative work. I do not have people at my disposal to do that work for me. Or I do not have a laptop, or I do not have a computer. Every time I have to go and request someone else in someone's office, please, can you get this letter through for me? You know, you're uncomfortable in your position. Then, some material might be out of stock. Okay, I'm doing trainings. I don't have, say, a projector.
Come in, ma'am.
Yeah, sure, please. How am I supposed to make a presentation to my target audience without the projector? Right? Issues like that which irritate us, you know, which create dissatisfaction at the workplace. Or, as a doctor, I'm supposed to have an OPD and there is someone else sitting in my OPD when I go there. Or, you know, very small things. Doctors have fragile egos. All of us have very fragile egos. Mera OPD hai and someone else's nameplate is outside. I'm not going to sit in the OPD. I make a written complaint to the management. What is this? So it leads to employee dissatisfaction. Very small things lead to employee dissatisfaction. And one of the most frustrating things in a hospital is when you're really performing, when you're doing your job, and your equipment is out of order. You're going to use the lift is out the door. Every time you have to climb 3 floors to reach your office, then you have to come down for a lecture, or you have to come down to see the patient, go up again to your office. It creates small irritants in your path which lead to dissatisfaction. You start mumbling things like, can't this be done, can't this be done? Then you take up the issue at a higher level. And when you don't get a response there, then you get frustrated. Eventually it translates into job dissatisfaction. For to tackle employee dissatisfaction, it is very important to give our employees a good workplace and to give them good amenities at home, to give them incentives to recognize and cash in on their motivations. India's every organization, however so much you try to discourage it, it forms a Kuteri culture. You have a head or a chief executive, and you have a group of people surrounding the chief executive who are the so-called blue-eyed boys or girls, and because of their existence, you naturally end up with heartburn. It may not be deliberate. They might not be doing something to disparage you in your position. But there is a comparison. Why is he blue-eyed? Why am I not blue-eyed? That comparison comes in, it leads to dissatisfaction. Then sometimes there may not be proper communication. The mission of the hospital or any project that is being undertaken might not be told to everyone. The others get irritated. Why was I not told? I'm not going to attend it. Or do they think of themselves? They just keep these things to themselves because they know this will bring in good publicity. They don't want our involvement. And how does it come out? How does this grudge come out? It comes out in talking to your peers. It comes out in talking to your family. It comes out in talking to your friends. On the whole, it creates bad publicity for your organization. You don't feel part of your team. So what do you do to make sure that your employees are satisfied? Give them a good pay packet, give them good working conditions. If they have a problem, if they've approached you with a problem, you judge the problem on its merits and then take a decision. In case you have to say no to them, it has to be done politely, and you have to give reasons for why you are refusing what they are asking. You have to have tangible reasons. If it's a decision based on high-handedness, be sure it will boomerang on you. And develop good interpersonal relationship with your employees. I'm sorry, I'm referring to last night's conversation. But if you want your management to see your point of view, it is very necessary for you to see their point of view. If you expect them to listen to you, it is very necessary that you listen to them first. Similarly, for the management, if you expect your employees to work for you, to listen to you, please learn to listen to them. Who was it? J.R.D. Tata once said, the best ideas come from the other side of the table. Learn to listen. Learn to listen, don't be very reactive. Give your reaction. It's not that you have to suppress your reaction. Give your reaction, but get your thoughts together and put it across in a very polite manner. Don't bench what you have to say, just say it in a very nice way. Look after the welfare of your employee and his family. At least ask about them, even if you're not directly involved. I'll tell you one thing. An exercise in public relations, we've learned it practically from our professor. All of us are here because of public relations, his public relations. That's his public relations. He's managed to get us together from all parts of India. Only because of public relations. Whenever a new employee enters an organization, he must be given proper induction training. He must be told of what is where and how to go about things. Because he often commits fatal mistakes, and probably those first images that he forms of the organization in the first days, they linger with him always. If he's got a good experience, it will stay with him. You will gain the loyalty of the newcomer at once. If it's a bad experience, that will also stay with him. It might take months to change the first impression. Then interact constantly with the staff. All management gurus have encouraged informal interaction with the staff. We've had the concept of quality circles wherein people get together in the evenings, discuss shop, they discuss what happened in the daytime. They discuss informal things too. It's a lovely form of bonding without the formality and the atmosphere of the office, where you can put across what you want to say without barriers. And if there is, have a formal grievance redressal mechanism. Have some kind of grievance redressal team or a grievance redressal, a complaint box wherein people can put in their complaints, and even if it is anonymous, even if it is unsigned, please pay attention to what is written there, and if it seems to be sensible, if it has some merit to it, it has to be discussed and things have to be sorted out. It has been put in there because there is some dissatisfaction in the first place. And it's very, very important to have healthy relations with any kind of unions within the organization. Now, this itself will take 2 lectures. We will not go into it in detail, but maintaining equanimity, maintaining good relations, maintaining two-way communication with unions is very, very important. And every employee should get orientation, reorientation in communication skills. Communication within the system, communication with external customers is very important. Now, why do we have patient dissatisfaction? One of the prime reasons for patient dissatisfaction, I said, was staff dissatisfaction. Because staff dissatisfaction is bound to translate into patient dissatisfaction. You're irritated with your boss, you take it out on the patient. The records technician, he's sitting at the registration office, he's had a bad day, he's had a long queue of people, he's been telling his boss, please give me another man, I can't take the load alone. The boss does not listen to him. So by the time it's, say, 2 hours down the line, he's so irritated, he starts snapping at the patient. And if the patient who's come there, he's already got an ailment, and then he's got a person snapping at him at the registration counter. He says, what the hell, I'm not going to come into this hospital again. People don't know how to talk. What do they treat me? I'm going home. Patient dissatisfaction occurs when there is a failure to meet their expectation. And what do patients expect? What do you think patients expect from you? Please, from the house. What do you think a patient who comes to you for? Why does he come to you? He comes to get treated?
Definitely.
Or he just comes to spend some time there in office with you? Why does the patient come to a hospital?
For his service.
Sorry?
For his service.
For the service. And what kind of service does he expect?
Prompt.
Yes.
The prompt service.
Sorry?
Prompt action, prompt service expected.
Prompt service, yes. That's one of the prime requirements of every patient. What else?
I think in addition to that, can it be empathy? Seeking empathy from the...
Especially empathy from our profession. And the basic requirements of a patient when he comes to a hospital. Broadly it is he has an ailment. He wants to get treated. He needs some medical advice. He wants that advice. But within that, there are so many shades. One of them, a patient expects quick relief. If a patient is critical, he expects he will be seen on a priority basis. If not on a priority basis, the least a patient expects is that when it is his turn, he will be seen. And most fights in the hospital start in the OPD because someone else is seen out of turn. What do we do when we see someone out of turn? To oblige one person, we disoblige so many people. So how do we tackle this? How do we tackle? And believe me, even in an OPD, when you see a critical patient out of turn, the others are not disobliged. They understand. Our patients are mature enough, our customers are mature enough to understand that if a patient is serious, he has to be seen on a priority basis. Most of them, even if someone raises a voice, if someone raises their voice, and if you explain to them that this patient really needs emergent care, they understand. We create a problem when we see VIPs out of turn, when we see family friends out of turn. So, down the ages, different systems have been devised to tackle this. I remember my professor used to tell me, in medical school, he used to say, you have to oblige VIPs, and you have to make sure you don't disoblige other people. So, he used to tell the man at the registration counter, for every 4 patients that you issue a card to, keep the 5th card blank. Then go to 1, 2, 3, 4, keep 5 blank, keep it with yourself. Then go to 6, 7, 8, 9, keep the 10th one with yourself. And whenever a VIP would come, he would give them that card which was left, number 5 or number 10. And the VIP would get seen when his order came. When number 5's turn came, number 5 was called out and the VIP would go in. So he would have to wait for a brief period of time till the first 4 patients were seen. But he was given preference over the others. But it was done in such a way that the others also knew he's coming as per his own number, as per his turn. So there are times when you have to compromise. And this was one of those solutions. What happened as a result of this was, the person who had come to visit you got his thing, got his priority, and the others knew he was coming on turn. He was being seen on turn. So similarly, a patient expects to be seen on the same day, a patient expects to be seen when it is his turn, and a patient expects some amount of courtesy and attention. In our private hospitals, courtesy and attention are always there. In the public sector, we use overcrowding and the workload as an excuse to forego these basic tenets of civic behavior. We all do it. I do it. I've done it. My peers have done it. I've seen it in the system. But now times are changing. It can really cost you dear. Major mistakes which doctors have made have not been made public, have not become issues, only because the doctor was courteous, only because the doctor was attentive, only because in a very nice way, he at times, not always, admitted his mistake and said that he would do his best to remedy it. Everyone knows that no one does these things deliberately, but it's just the way you put it across to the people. So we say that there is a shortage of staff, we have a lot of workload, we can't be expected to be polite. But then there's the other issue of staff discipline. My registration counter has not opened, my patients have been standing there. The counter was supposed to open at 8:30, it's 9:15 and the counter has not opened. The patient is bound to get irritated. It is bound to inculcate bad public relations. You have to have staff discipline. You have to make sure that the staff is at its proper place and doing what it is needed to do. And whenever there is an emergency, you have to have a backup. But mostly patients do realize that there has been an emergency and they wait. I remember a time when I'd gone to get a check made from a bank. I'd taken a half-day leave from my hospital and gone. So there was no one there at the counter in the bank to make the check. Kept waiting and then finally I asked the fellow there, I said, I've put in a half-day leave, my leave time is nearly up. When will your person come? He says, doctor kya karte hai? What do you guys do? The other day I went into the emergency of your college and there was no one there. My friend was so ill. Finally we had to ship him to a private hospital. And I remember what I said. I told him, वहाँ का भी डॉक्टर किसी बैंक में चेक बनाने गया होगा और लाइन में वेट कर रहा होगा और चेक बुक काउंटर पे नहीं होगा. You see, I was so irritated there. Similarly, the patient gets irritated when he comes to us. The man, and all regard to him, he made my check immediately and let me go. But the fact is that everywhere where these things happen, it leads to bad PR. This man managed, he did a lot of damage control by getting my job done immediately. I think I'm going down in circles. And there is some waiting which can't be helped, Sometimes patients come in too early. Patients are usually very agitated, they might miss an appointment and they're there too early. Or the doctor there might be an emergency at the theatre and the doctor might have to rush off there. There might be a sudden commitment for the doctor. In which case the management has to put in good communication. They have to inform the patients that this is what has happened, please bear with us. Or they might open an extended OPD or send in an alternative, send in a substitute at that place. Every place has its own constraints. It is not always possible. But the least we can do is we can communicate politely to the patient. And if there is a critical patient, he has to be attended to. For indifferent care, we need to give the human touch. For low quality care, and believe me, patients assess care on the basis of very mundane things that we can remedy immediately. Cleanliness of the hospital, good linen, meals at the proper time, served at the proper time. They are no judges of the technical aspect of the care, but they judge the skill of caregiving very well. And the skill of caregiving, I think for all of us doctors, it is the easy part. You don't need to open huge books to read on them. We all need to imbibe the right attitude. We are a part of the public is a part of us. If we are polite to them, we are polite to ourselves. We are making, I wish that gentleman was here today, we are making our own security. The best security for a doctor is not given huge police vehicles, or a doctor is not given a guard to watch him. The best security we have is our attitude, our behavior, and our words. We have to be very systematic in conveying to the patient the facilities available within the hospital. We have to make sure the patient receives proper guidance on where to go, what to do. That he is not, there is a tendency for most professionals when they go higher up, not just doctors, but every professional, he stops making eye contact with the patient, with the client. This I've seen in almost all organizations. As you go up, you don't have time for the other person. You are busy writing, you don't even look up when the other person comes. It is not just with doctors. I think doctors are still better where this is concerned. We do manage to make eye contact. This is very necessary. Make eye contact, guide the patient properly. If the patient has brought his lab investigations or something, please read them and guide him properly. Don't say, "Usme laga do, main dekhuga." Get back to him immediately. Show him that you care. The management, for those of you who are in charge of their own hospitals also, we have to make sure that the patient is comfortable, that there is drinking water, that there is a place to sit, that the fan is working properly in case the room is claustrophobic, the windows are open, or there is an AC system, or there is an air exchange system. Small physical comforts go a long way in making the patient come back to a hospital. Towards the external public, what do we do? Towards the external public, the media is a very powerful tool to communicate, to get back to the external public with good public relations. We've been, down the ages, hospitals have been participating in different melas. Hospitals have been participating in national programs, outreach programs. They have been using the newspaper and the media and the radio to, we are not supposed to advertise, but we can always use the media to inculcate good public relations, to tell them about the services. In my own state, under the NRHM, we are using the radio very, very actively to promote new services available under NRHM. Adolescent health is something which has come up under NRHM. We use the radio to tell people that we do have adolescent health clinics, that we do have facilities for sexually transmitted diseases. Similarly, the blood bank uses the media very frequently to ask for blood. You know, when you do this, it is not just that you are telling them you need blood, it is also that you are telling them you have a blood bank which is actively functioning, that you can come back to that blood bank, that you do have this service. It all comes back to economy in today's world. And now we have not just radio and TV and newspapers, we also have the email, we also have web conferencing, video conferencing, websites. Use them all actively to inculcate good public relations, to demystify our profession in the eyes of the public. Our own attitude, our own behavior, as in a very important place where we miss out on good attitude is when the patient dies, when he has to go to the mortuary. It's like, you know, the end of the story. The patient is dead, we can't do any more, please take him away, you tell the NO, remove the body, take it to the mortuary. But that is perhaps the time when the patient needs you the most. When he needs what someone here just said, empathetic treatment. That is the time to make good public relations. That is the time when you say, we can't do more for your patient, but please, you can do something for the attendant. You can at least make him feel that he came to a place where the best possible was done. And even if it did not work out, the people are concerned still. They are concerned enough to say, please sir, sit down, have a glass of water. I'll arrange for someone to come with you, to take you, to help you finalize the formalities. Small things which we do, which can go a long way in cultivating good public relations. All these principles have to be specially taken care of in high population, in high turnover areas, which are your OPD, or your emergency. The emergency is frequently witness to fights and brawls. It's because of the high turnover, it's because of the critical nature of work done there. So these principles have to be specially kept in mind in these regions. The basis for a positive image in a hospital is a technically competent staff and mutual trust between the hospital, its internal as well as external customers. Now, to promote good PR in a hospital, from a management point of view, we say we use two methods. We've actually discussed both the methods here. It's just that I'm giving you formal terminology for those methods. We have the operative method, in which we strengthen the operations of a hospital. We just provide better care. We make things available. We make things available on time. We make quality things available on time. Our processes within the hospital are strengthened. And then we have the communicative method. The communicative method says we employ mass media, we employ our interpersonal skills, we employ good communication between the hospital and its customers. Now, how do we measure good PR? How do we say that this hospital has good public relations? I believe there is a separate lecture on customer satisfaction. So how do we gauge customer satisfaction? I will just tell you a few pointers. I'll give you a few pointers which will be discussed later. Very often it is said that while a patient is in the hospital, he may not be very honest with the kind of care he's being given, because he says, अगर मैंने negative बात कर लिया तो मुझे sister आके ठीक से treat नहीं करेगी. I will not probably get my meal on time, or she will not come for my next injection. So what we try to do is, understanding that behavioral pattern of the patient, we try to go for exit interviews. We interview the patient as or when he is leaving. Or we keep complaint boxes all over the place, wherein a person can drop in the complaint he has, if he has any complaint, with or without his name written on it. These are very simple ways in which you can judge the PR of your hospital. You have active methods for judging PR and you have passive methods for judging PR. Passive methods would be, as in the hospital doesn't do anything. It just waits for the number of complaints. You're comparing 5 hospitals. Hospital number 2 has the maximum number of complaints against. Hospital number 3 has no complaints against. So hospital 3 has better PR. That is a very passive way of judging your PR. Okay. Another passive way is you wait for grants and all. This hospital number 4 keeps getting grants from people. That means somewhere down the line, hospital number 4 has managed to maintain very good PR with those people who matter. They keep giving it grants or they keep involving it in their programs. That's a passive way of measuring PR. Active ways of measuring PR I just discussed. Exit interviews. You look actively for complaints. You give patient satisfaction forms you conduct patient satisfaction surveys. They are active ways of measuring PR in a hospital. But we have to realize today, whatever method we employ, even if we sit back and wait in the passive method, PR is very necessary for our function. We are a part of the public. Our processes today, it's not just one doctor sitting with a stethoscope in a room treating patients on a one-to-one basis. Today, it is huge institutions which are coming up. Every aspect of our functioning is related to either some legality or to some functioning of another department. And the excuse that doctors have long used of being, of being on duty round the clock, it does not hold true today. The police remains on duty round the clock. The firefighters remain on duty round the clock. Even banks remain on duty. The pressures that we face, they face too. It's just that what we are offering, the service we are offering, is very sensitive. Lives can go. It's not just money which can go. It's not just buildings which can be burnt. It is lives. So it is a high pressure area. That remains true. But because it's a high pressure area, we have to be even more careful in dealing with it. Thank you.
Thank you, Dr. Anupam. Now I request Rajiv to please ask the question.
I have a question to Dr. Sharma, program coordinator. Being a very good referral